we're going to talk about the environmental room risk assessment. Once you've identified your patient's mitigation risks, you're also going to review the patient's room. Next, we're going to show you how to use a smart phrase and review the environmental room risk assessment. Let's review this in Epic now. Within Notes, you can type a plan of care note and you can add your smart phrase in. That's a system smart phrase that we can all utilize. I want to bring your attention to the very bottom. There is an action key here. The R stands for risk removed, the A stands for your alert to the risk, and the NA is not applicable. If I scroll up here, you have a brief set of instructions. So upon your admission for the patient and on every patient room change, the patient's environment is assessed and that needs to be documented. This is a way that we have been able to prove that the patient's room has been assessed. For training purposes, I will not go through all areas, but notice how you can click the boxes to signify what you're doing to help keep the patient safe as part of a mitigation strategy. Please note that if a patient changes from the ICU to come to Med-Surg, the Med-Surg room is different than the ICU room and will warrant another environmental suicide risk assessment and intervention. I'm going to sign my note, and then you'll be able to see my note within the All Notes section for my plan of care. Now that you've completed your environmental room risk assessment as a mitigation plan, we're also going to show you how you can communicate with nutrition services, which is also your dietary. All patients that are at risk for suicide need to be made aware that the patient needs paper services from nutrition services. Let's review how to do this in Epic now. I will go into my orders section, and my patient currently has a general diet. From the general diet, you can further select within the order service instructions. I can add paper service as a service instruction. Notice how you can do that through going through this section to select from. You can also add a comment to let nutrition services know that you have a suicidal patient. I'm going to sign my order. And click accept. The nurse will also want to document a care plan unique for their patient, as well as completing the patient education. You'll also want to do your reassessment screening by using the CSSRS daily shift screen flowsheet. You're going to go through these questions and ask these questions of your patient each shift or per your hospital ministry policy. Notice here how my automatically calculated level of risk populates. This patient is high risk for suicide. Patients can start to answer these questions and say no to everything. This is why it's so important to ensure that you're communicating with your provider and utilizing psychiatry services as appropriate. I'm going to also identify my plans to mitigate risk for suicide for this patient. You can select more than one item. So for training purposes, I will keep this at a minimum. Next, I will be communicating with my provider on what the overall level of risk is for this patient. The provider and clinical team will utilize the risk assessment along with this daily shift screening tool to come up with the overall level of risk for suicide.